Good morning, my name is Jojo Thomas, and this is my oral presentation of Strategic Planning for Nursing 620. This strategic plan is for Florida Hospital Surgical and Transplant Unit to increase the patient satisfaction score with the communication with the physician in HCAHPS, that is, the Hospital Consumer Assessment of Healthcare and Provider System. In detail, the nurse leaders will facilitate RN-MD rounding to improve the communication with patients, to increase the understanding among the patients about the treatment plan and progress, and it will result in a higher patient satisfaction score. Currently, the transplant surgical unit, the physician communication score in HCAHPS is only 65%, which is far below the expected 90%. With the recommended nurse-physician rounding, the goal is to bring the communication score above 90%. In the SWOT analysis about the transplant and surgical unit, the strengths of the units are: there is a good nurse-patient ratio, a very cooperative physician, good patient satisfaction score other than the doctor communication, supporting and determined staff, and leadership, a well-coordinated team of nurses and doctors. Weaknesses are lack of expected time for the nurses to coordinate with the doctor round, patients not prepared for asking questions for doctors, post-operative pain medication interfere with the patient's ability to ask questions during doctor rounds. Opportunities. With proper doctor-nurse communication, there will be a better understanding among healthcare team, and there will be an increased patient safety, increased patient satisfaction with the proper communication with doctors. Threats. Although there is a good patient satisfaction in other areas, the lack of proper communication of doctors affect the overall score. The patient safety is a big concern due to misunderstanding among the healthcare providers. Lack of satisfaction can affect the overall business, as elective surgery patients may go for better outcome hospitals. Description of strategies to utilize. Personally, with an existing system of doctors rounds, there is only minimal information shared with the patient, and that will result in a lack of understanding among patients and several of miscommunication among healthcare team. Implementing an RN-MD rounding will be a strategy to potentially increase the score. RN-MD rounding is when the doctors and the nurses round together on patients in order to improve communication. Studies have shown that RN-MD rounding physicians felt that there is a significant decrease in the hierarchical distance with the patients, and the patients were able to communicate more ordinary conversation with the doctors. The proposed steps in the process are: communication pad can be provided to patients in advance, where the patients are able to write down their questions in advance for the doctors. And the physician will notify the unit secretaries on arrival to the unit, stating which are the rooms that they're going to round, and the unit secretaries will communicate that with the nurses. The nurse and the physician will have a pre-visit communication outside the room in order to update the recent changes. And the nurse will actively involve in the rounding process to facilitate any questions that the patient will have and address the communication pad. Communication plan for the success. An email communication to all directors and the medical directors will be sent to adequate support. Communication will contain the problem, the plan for improvement, and the benefit of the plan. In detail, the explanation of the unit-specific processes, including the steps and the expected role of nurses and the doctors, will be attached. Communication among nurses and doctors will be multiple email communications and face-to-face communications. Messages including the goal, the strategies, and the measures will be sent out. Our leaders will meet with employees to clarify any questions or doubts they have about the process. The leadership also will meet with the doctors about the intended process to improve the communication. Leadership skill to draw upon implementation of such plan. Having that vital conversation with the employees and team members are very important for the success of the process. Individual conversation with team members about the vital role will be very much useful. Continuous supervision and guidance should be provided to enhance the success. Share control. Enabling the charge nurses and the silent leaders in the unit to assess the R&MD rounding will help them motivate while assuring the success of the process. Unit secretaries will be asked to monitor the process and announce the doctor's presence in the unit. Clarification for nurses' role in the process and giving the opportunity for the nurses to ask questions will be very much useful. And this complete my oral presentation about improving the communication in the surgical transplant unit for the hospital. If you have any questions, please let me know, and thank you.